was the right and left coronary coming off the tube. Now remember, this is going underneath the pulmonary trunk. So since this is left, and this is right, remember, you have to line it up like it's in your body because you're looking at the person right now. So your left side is always going to be the right, your right side is always going to be the left. Good? All right. So we can tell right from left because thin and thick. Same thing on the real hearts over there. We talked about the auricle. We talked about the blood vessels going in between here, okay? So as the left comes off, what you see is basically it. Then it splits. It goes like this. Okay, so it goes down the middle. So this is the left anterior descending, and it is in the atrioventricular, the anterior interventricular sulcus. Okay, anterior interventricular sulcus. So that's where it is. Then the circumflex goes around, and it's going to feed front and side, right, left side of the heart. Okay. Then we talked about the right. The right comes off. It's got this marginal that comes here, and then it deeps down into the posterior interventricular artery in the posterior interventricular sulcus. Cool? All right. Then we talked the venous system. Here's the great cardiac vein. So the great cardiac vein is in the anterior interventricular sulcus with the left anterior descending. Okay, so make sure, I told you to put that on your notes, make sure you understand that concept, that they're both in there. And then the middle is on the back with the posterior interventricular artery. We have the middle, comes up, and they are both going to drain into the coronary sinus, right? Okay, so now we're going to start with deoxygenated blood going into the right, going to the lungs, coming back to the left, and then going to get pumped out to the rest of the body. Okay, so the three tubes that we need to be concerned with, we already talked about the coronary sinus, the superior vena cava, the inferior vena cava. Okay, we didn't label that on the heart. We could have done that on the real heart. We missed our opportunity, didn't we? Okay. This is our pinna, our ears on the heart. Okay, we also have that labeled in the real heart. Cool? We come in here, and in here we have pectinate muscle and we have the crista terminalis, and we said this big model here was the better one. All right, who stole the... Kids nowadays, it's trick or treat, so they trick me. Okay, so this is, you can see that this is the same thing. There's superior vena cava, inferior vena cava, there's coronary sinus, and so just like we dissected on ours, you know, we cut the pinna and we open it up. This area between the pectinate muscle and the smooth part over here, this right here that has this, whatever that is, 33, whatever, I can't read it. Okay, make up your own number. Okay, this is the crista terminalis. Good? Crista terminalis, this is what it looks like in 3D. Okay. Okay, so we got this off. We know that the sinoatrial node is going to be in the crista terminalis close to the superior vena cava. Okay, so name the conducting system that's in this general location. Okay, there's nothing I can really point the pointer on. I just have to infer. Okay, down here, this is the opening of the coronary sinus. Okay, draining the heart into the right auricle. We know that between here and the valve here is where we're going to find the atrioventricular node of the conducting system. Okay, so up here, right in there. So again, we'll ask that question that way. what part of the conducting system is in this general location. Good? All right. All right, so we come through here. This, which valve is this?
Tricuspid.
Tricuspid, because there's 3 cusps. Okay, so 1, 2, and then 3 is on the part we took out. Okay, and we know that there's 3 parts to the valve. There's the valve itself, the tricuspid valve. There's the chordae tendineae, and then there's the papillary muscle. And we understand that they're not, those chordae tendineae aren't there to pull the door open. They're to keep the door from flipping back up into the other, into the atrium again. So gravity is going, or just pressure difference is going to let the blood just come flying in. Okay, now we're in the ventricle. We know that this is the right ventricle because it's thinner. The left ventricle is thick. Good? We know we have trabeculae carne, the old meat bar is in there. Remember when I start a restaurant, call it meat bar. Okay. We squeeze and the chordae tendineae keep these things closed so that the blood doesn't go over there, and it shunts the blood over to the pulmonary semilunar valve. Right? Then it goes to the pulmonary trunk. Remember, these are the pulmonary arteries, even though they're blue. They're carrying deoxygenated blood to the lungs. The lungs do their thing. They oxygenate the blood comes back through the pulmonary veins. Okay, so this is one of the only places we're going to see that the color is not the same, right? Even though this is an artery, it's got deoxygenated blood. Even though this is a vein, it's got oxygenated blood. We come into the left auricle. Can't see it on here, and we didn't label it on that one. But there is a fossa ovalis that one time was a fossa foraminovalis, and it connected the sides. There's a thin membrane. We also have this little thing here. What's it called?
Some ligament into.
The what?
It starts with an A.
Yeah,
And
it's all right. Let me see your notes.
I can't remember what.
Having a senior moment here. Yeah, ligamentum arteriosum. Okay.
Yes, ligamentum.
Okay. So again, this used to be a connectin in fetal life from the atrium to the, because we didn't need that. Okay, mom was oxygenating our blood for us, so we didn't need that. Okay, so anyway, we come in from the left auricle and we're going into the left ventricle through the bicuspid valve or the mitral valve. And it has the same stuff. We have the chordae tendineae attached to the pectinate, to the papillary muscle, and then we have trabeculae carne. We squish, we go through the the aortic semilunar valve. Good? All right, that is the heart. Everything that's on here, you're responsible to know on here and on the real heart. So let's look at the real heart. This one is frozen in time. Remember, you guys dissected this last week. Okay, so here is the guide, the what do you call this?
Key.
The key, yeah, the key. Okay, so
The key
the
to
pinna,
your heart.
the pinna. So this is through the little ears. Okay, so we talked about that. We grabbed it last week by the pinna and we held it up. Okay, the pectinate muscle is going to be in here, so it's got marked there. I might move that because the stick's in the way now. But remember, the pectinate muscle is the muscle that's in the auricles. Then there's the valve. Got the pin through the AV valve. There's the chordae tendineae, and then number 5 is into the. Don't make me listen to myself. I sound like such a country bumpkin. Okay. So there's the papillary muscle. Number 7 is, number 6 is the trabeculae carne. Number 7, remember we had the best one right there, is the moderator band. Okay, part of the conducting system also keeps the thing from flipping out. And then the pulmonary semilunar valve, well, if it thaws enough, I'll put it through so you can see it come from here through there, but this is frozen, so I can't get it in any deeper than that, okay? I want you to put this on your notes, though, before you start. We actually dissected the back side instead of the front side. Okay, so I told you that the pulmonary is in front, anterior to the aorta. Well, it is, but we're looking at it from the back view, so now it looks like it's in front of the. So just remember that on the dissected heart, we dissected the back view. We did it correct in the left side. Okay, so left side we got the pectinate muscle in the auricle, and.
It is wrong thing again.
Do I?
Both of them we went like from the wrong side.
No, this is correct. This is an anterior view.
So isn't that the one I did?
I think so, but that is.
Yeah, I entered the way that you say, and then we all went through the back.
Well, we went through the back on this one, but see, we have the same. There's the pulmonary, there's the aorta. Okay, granted, this is a side view because we had to do the left, but it is an anterior view. There's the anterior interventricular sulcus. So we actually did it. We actually cut the front side on this one.
But I didn't. I don't know.
Yeah, see, this is posterior. This is anterior. This is a posterior. This guy, we cut him like this, and this one, we cut him like this. Okay.
Okay.
No, just trust me.
Okay.
Okay. Okay. So this is the pinna. There's the pectinate muscle in the pinna. Okay. There is your tricuspid valve, number 2. There's the chordae tendineae. That's wait a minute. Is that chordae tendineae? That's not chordae tendineae. That's chordae tendineae, and that's a really beautiful chordae tendineae. I mean, have you ever seen prettier chordae tendineae than that?
May have to wash your hands.
Nah, just like them. Okay, and then okay, let's move this. So if that's chordae tendineae, what muscle must this be then?
Pepperoni.
Okay, and then the trabeculate carni, and then the aortic semilunar valve. Okay, so now this is correct. Correct?
Correct the mundo.
All right, let me wash my hands. All right. So that is the heart. Okay. All right, so now we moved on to the circulatory system. And we had several of these. Everything that is open and tagged that has the same structures is going to be tagged. Okay, so there's that one. There's, well, that's not very good. Most of what we did was on this one. Is there another model anywhere? Don't let me forget to take this back. Wait a minute. Yeah, they're testing tomorrow too. Okay, so we know about the 3 tubes coming off the heart. Okay, we know that this is the brachiocephalic trunk. Brachiocephalic trunk, because it's one tube that's going to branch up into the brain, or up into the head, and over to the right arm. Cool. Okay, so this is the brachiocephalic trunk. Then the next tube is the left common carotid, and then the third one is the left brachiocephalic. I mean the left brachio. Good? Okay, so we know, if you know your skeletal anatomy, then you can name these arteries, because they just follow that. So this area right here is where the clavicle is. So it's called the clavicular. We get into the axillary area, so it's axillary. We get into the arm, so that's brachial. And then we follow the names of the radius and the ulna. So thumb side is radius, pinky side is ulna. And there we have it. And then it just becomes palmar, okay, or dorsum too. But we're not going to get into the semantics here. Okay, so we continue on. We drop down here. These are just thoracic, so there's really no need to name them, okay, because they don't have any special name other than thoracic. But once we pop the diaphragm, then we start seeing changes here, okay? So there is the celiac, very first tube. So you notice, there's the diaphragm. Just as we pop out from underneath it is the brachiocephalic trunk. So this is the diaphragm. It's not as well defined as this one here, okay, because the diaphragm actually is a dome. It actually comes back and comes over up under the rib cage there. So, but there's the brachiocephalic trunk. There's the brachiocephalic trunk. This is the only one that actually takes the blood vessels to the organ. So you can't name this one as the gastric or the hepatic or the splenic because you can't see it going there. And the reason, and I'm here to tell you, for as many as I've dissected, they don't always, just because they're pointing that way doesn't mean they're going to the spleen, or if they're pointing that way, going to the liver. Sometimes they did like this. They would do like this. One came off this way and went to the liver, and then the other one went back that way to the spleen. So these don't read the textbooks. These don't look at the models. You know, your bodies don't look at the models. They do whatever they want to. Okay, but anyway, on this one, that is the spleen. Can I spleen something to you? Okay, so this is the spleen, so that's the splenic. This is the liver, so this is the hepatic. Okay, and then this is the only thing that left, so that's the gastric. And that's actually this is superior and inferior gastric, but we're not going to get into semantics on that. Cool? All right, so then the next tube is this one right here, and your landmark is the kidney vein coming from there, and it's just popping right up over it. So you notice it's in all three of them, it's the same way. Okay, so that's your landmark, that renal vein coming into the inferior vena cava. So this is superior mesenteric. Okay, so we got this one and this one. They're both going to go to the intestines. Okay, so superior mesenteric, superior mesenteric. Okay, then right underneath it, or right next to it here, is the renal. If it goes to the kidney, then it's the renal, right? So that's the logic on this. Okay, and the vein coming from that is also the renal vein. All right, we continue on, and you can see this here. This, you must be a guy. Okay, so this is probably the testicular. This is the gonadal. And you must be testicular also. Normally you don't have a heart down there. The heart is usually up here. Okay, so this is, it's not where, my ears red. My class is getting X-rated. Okay, so as we continue down, these are the gonadals. Then that one is the inferior mesenteric. Okay, so middle gut is what mesenteric means. Okay, then we get to a split. So you see the split, and the split is only this much. It's only that much until there's another branching. Okay, then we have different names. Okay, so same thing over here. Okay, so this is the common iliacs. Then as it goes deep in there, that's the internal iliac. And then as it continues towards the lower extremity, it becomes the external iliac. Then once we pop out of the iliac, of the inguinal ligament, then it becomes the femoral. And we didn't look at this the other day. But this is also game because it has the same structure. All right, buddy, move it. Okay, so this is the common, the internal iliac, and all right, dude, come on. There There's your femoral artery and vein. By the way, that's also the femoral nerve. Good. All right. We keep coming down. You'll notice how this thing starts out anteriorly and it's going to end up posteriorly. Okay, when it gets into this space right here, it becomes the popliteal. Okay, and then it continues down and it becomes the posterior tibial. But here's what I couldn't explain the other day because of this model. There's a membrane. Of course, remember we've got the tibia and fibula, and there's a membrane that connects the tibia and the fibula, right? At the top, there's an opening so that this posterior tibial can actually pop through and become the anterior tibial. And then the anterior tibial becomes the dorsal pedis. Okay, and I don't think I mentioned this the other day, but as far as nursing school goes or whatever program you go to, they're going to make you palpate this one, and that one. But in reality, if you palpate the dorsal pedis and you feel a strong pulse, then this one is pat and that one's pat. And there is no need to be, messing with people's groins or the back of, because this one is difficult. This one you have to like slightly bend the knee and really press in there to feel it. This one's easy. You have them lift their big toe, that ligament comes up and it's right next door. Okay, so dorsal pedis is going to be the easiest one to get. Cool? All right, then we have some special veins we need to talk about. Okay, so we talked about the basilic and the cephalic coming here. Okay, these, and actually the basic starts all the way down here. The ones that follow these are the radial and the ulnar. Okay, these are more superficial, so these here that you see up here are the basilic. Okay, and basilic, cephalic. These are the carotids. I mean the jugulars coming down. And remember, we said this model was inaccurate because this one should have its own tube that comes down here. And we also talked about veins that drain the brain. Let's see if we got anything else that I can use. Okay, so this is superior sagittal. The inferior sagittal is going to be right here. Then we have the straight, and then there's the confluens, and then we talked about the sigmoid coming down, and then they're going to pop out as the internal and the external jugular. Which, does this one look correct? No, see, it's got a branch there too. But actually, if you look up, we have the external jugular and the internal jugular, external jugular anastomose into the subclavian, and so does the internal. Okay, so we have both of those going in there. And then we talked about the great saphenous, and then the lesser saphenous. So remember, this is femoral vein and artery. This is the greater saphenous. Okay, and is this guy showing the greater saphenous? No, it's probably coming off here, and then that would be the greater saphenous, but I don't see anything great on that. It's all pretty mundane. Okay. All right, and then, we have this model here, and we looked at funny guy over there, whatever this guy is. We saw the hepatic portal. On this model, it's real easy because it's the purple. Okay, the purple are draining the viscera. They're taking everything to the liver. Okay, then the liver, these veins here, see the blue veins coming from the liver to the inferior vena cava? Those are hepatic veins. The purple are hepatic portal veins. So don't get confused with that, okay? So we have hepatic veins and we have hepatic portal. The hepatic portal are going to the liver. The hepatic veins are coming from the liver to the inferior vena cava, okay? And they have the same coloring as these here. Cool. And then we got the subclavians. Okay, so, the azygous are the ones in this guy right here. Okay, drain the chest. So they're coming in here. So those are the azygous veins. funny guy over there, he also has azygous veins, and we'll go over there and talk about the lymphatic system when we get there. But first, we have to talk about the circle of what you talking about, Willis. You even know what I'm talking about when I say that?
Circle of peace.
Well, I know, but what you talking about, Willis?
No.
It's on. You know, now you can watch everything from the 70s and 80s on TV. So this is Different Strokes, Gary Coleman. Have you seen it?
I don't know who Jerry Coleman is.
Gary Coleman.
Oh, I don't know who that is. I might have to see.
Well,
a
look up
picture.
Different Strokes and you'll see that. And his brother's name was Willis.
Okay, I have to.
And
look
so
it
he's
up.
always going like, "What you talking about, Willis? So what you talking about, Willis?"
Oh, okay.
It's hilarious. Unfortunately, I had to explain the joke to you. Sometimes I forget you're not in your late 90s like I am, and you've seen everything.
Late 90s.
Okay. I'm sorry, early 90s. I'm 93.
You're right.
You know, I did that to another class, and she was, "Are you really 93?"
Oh my gosh.
I said, "Yes, give or take, 30 years." All right, so we talked about that guy coming off of the. No, we didn't talk about him when we were doing the circulation. The first thing we got the carotids coming up, and we talked about the carotid splitting. So you can see it starting to split here. If I can find this guy's head, we may get more information. Okay, but it splits about here, and the internal jumps up that way, goes straight to the, well, we don't have it here, the carotid canal, about right here in the sphenoid, in the temporal bone. Okay, and then we also have, coming back there, the vertebral artery right here, that is going to jump back and go to the vertebrals. And it's going to go through all the cervical vertebrae. It's going to pop out, it's going to sort of go backwards, and then it's going to jump in to the foramen magnum, and they're going to unite. So the right and the left are going to unite, become the basilar. Okay, so remember, it's like this. So what you're seeing there is this right here. Okay, so there's the two branches of the vertebrals, and then they also give rise to the spinal. Okay, for the spinal cord. We come up, we got all these little branches coming off that go to the medulla and the pons and to the cerebellum back here. But the one we want to talk about is this very last one that's right there. That doesn't go to the cerebellum. That actually goes to the posterior cerebrum. So this is the posterior cerebrum. That last one is there. Then you'll notice there is a little branch. And that branch is the posterior communicating. Okay? The posterior communicating, because it's a circle of Willis. What you talking about, right? Cool? All right. Now these little poles right here are actually should be bigger, because these are the internal carotids that snuck up. Okay, and remember the internal carotids. They go into they're on either side of your trachea. They're coming up like this. They go up in, they're looking for the carotid canal, which is in the sphenoid bone. Then they're going to turn and go forward. And then they're going to turn and go upwards, the foramen lacerum, and they're going to end up right there. Okay? And remember, this is on either side of the pituitary gland. Okay, so the Turkish cell, let me get a skull. What? You don't want to come off? Okay, so there's the sella turcica. There's the hypophyseal fossa. That's what this thing goes into. So these things are coming out right here. Okay, the optic chiasm is going to be right here. Okay, so they're real close to that. Okay, so if you get a tumor or something in there, or a wearing away of the vessel, an aneurysm, that could, one of your symptoms is going to be impaired vision. Cool? And then, of course, if it bursts, They call that a baryaneurysm. If it bursts, it's going to cause bleeding in the brain and that kind of stuff. But that's one of the pathologies you can see. And the first thing they're going to complain about is eyesight problems, okay? And it's going to be a bilateral eyesight problem because it's in the chiasma. Remember, this is temporal side. It goes straight back. This crosses over because we have 3D vision in each eye, right? So they're going to talk about blurred vision or impaired vision in both eyes. If it's before the optic chiasma, then they're only going to complain about vision in one eye. Good? All right. Okay, so there is the carotid coming up, and it's going to branch laterally and anteriorly. Okay, so the lateral branching here is the middle cerebral. It's also this right here. Okay. It's this right here. So this is middle cerebral that we see here. Cool? And then it goes forward. It goes forward. There's a thin little tube that connects the two anteriors. Remember, the anteriors, great, doesn't have a blood supply. So the anteriors are right here. And they're in the midline. Okay, so they're in the sagittal plane. Okay, these are all laterally here. This one's posterior lateral, this is lateral here, but this takes the inside, okay? So like superior colossal and inferior colossal and all that kind of stuff coming here. And just remember, there's a little branch right there. Just tiny enough to connect the two anteriors as they're coming up, and that's the anterior communicating. Good? Mm-hmm. I don't know how to put this back. Oh, there you go. All right, so did I miss anything on the circulatory system? We got all the cool veins. We got the circle of Willie.
Lymphatic system.
Yeah, we're going to talk about the lymphatics now. All right, so lymphatics are pretty easy. So let's go to the lymphatic model. Walk this way. We're going to walk this way. This is my Halloween costume. What are you? I'm the lymphatic system. What can't you tell? All right, so this is the lymphatic system. Okay, so this is the hepatic portal. Okay, even though it's the same color as the rest of it, we know it's a hepatic portal because it's going to the liver. Okay, and this gives you a better idea on how it comes from the intestines and the stomach and all the viscera going to the liver. Cool? All right. So, cervical lymph nodes, axillary lymph nodes, inguinal lymph nodes, okay, popliteal lymph nodes. Just wherever you find them, that's what they're called, okay? They're called lymph nodes, okay? But this little part right here, there's a little white swelling. That is called a cisterna chyli, right? And then this is the thoracic duct, and the thoracic duct's going to turn, and it's going to drain into the left subclavian. Okay. Conversely, it's going to drain everything here. Cool? Then we have the right thoracic duct, or the right thoracic lymphatic duct, sorry, that just drains this. Okay, so that's that much. And there's a couple of the lymph organs that I forgot. They're on your notes that I didn't talk about. We have a couple of tonsils. So let me get. Okay, so here's a tonsil. That's a pharyngeal tonsil, and then let me go get it. This is supposed to be the lingual tonsil back there, but it's not done very well. Let me show you a good lingual tonsil. Oh, not that. Now that is a lingual tonsil. I mean, look at that. Wouldn't you say that's a tonsil? As opposed to this little dot right there? Okay, so lingual tonsil. Okay? Lingual tonsil. Cool?
Alright.
Okay, so there's pharyngeal tonsils, and even this is not accurate. The pharyngeal tonsils are actually on either side of the what do you call it? The not called a cavity. I forget what they call it back there. But you know, your tonsils are here, not in the midline. They're on this side, and if they get swollen, they get big. They can obstruct swallowing. Has anyone ever had like tonsillitis or anything like that? My little brother used to have them all the time, and they were all full of pus and everything. Would look in there just to get grossed out, you know. Mine got taken out, so I don't know where my tonsils are. They're long gone. Okay, yeah. You what?
They can go back.
No, they can't. No. Now, if I was a lizard, maybe they could grow back. You know, the tails grow back, but no. No, they're in a jar. Well, no, they probably got rid of them because I had them taken out back in 1925 or something like that.
1925.
Okay, so they're-
whatever.
I'm 93, right? Okay. So they're long gone. At any rate, that's it. That's the material we have for the test.
This is the
Okay.
lingual tonsil you said?
Yes, because it's on the lingua.
Okay.
Okay, this is the pharyngeal tonsil because it's in the pharynx
Okay.
area there. Okay,
So that's it?
that's it.